Good evening. This is Dale Wetzel. I'm the host of the Legislature Today radio program. We're broadcasting from the Peacock Alley American Bar and Grill in downtown Bismarck, North Dakota. And tonight it's pretty packed out, actually. There's lots of folks downstairs. We broadcast from the balcony, and there's lots of folks downstairs in the bar. Looks like they're having a good time. I'm here with my co-host, Gary Emineth, and our first half hour, we're going to be speaking about the possibility of the expansion of the Medicaid program to cover more people who do not have health insurance. And toward that end, we have with us the director of the North Dakota Department of Human Services. Her name is Maggie Anderson. We also have the chief financial officer of the agency, and her name is Deb McDermott. In the second half hour, we're going to be speaking to Attorney General Wayne Stenjum about a number of things, including guns and drugs and consumer protection, what people don't like, how people, the things people complain about. Let's just put it that way.
Well, if we get the Attorney General on, you're talking of it how to be a good boy or good woman, you want to make sure you're staying on the good side of that.
I just want to make sure
drugs,
that I want to complain about the picture on my concealed carry permit.
Well, then you have to work on getting dolled up before you go in there and take your overcoat off and put a mask on.
I can't take my overcoat off for reasons I'm not going to tell you. So what are the specials tonight?
Well, today is Teeny Tuesday for Martini Tuesday, 2 for 1. So those of you out there driving around, if you like a martini, they have a great big selection here at Peacock Alley. It's a little slippery out there, so I'd warn you to be careful. And, of course, when you come in, only have that one martini because you want to be, unless you got a designated driver. So.
Well, you can have something else besides a martini, too.
That's true. I see a couple people downstairs having some nice appetizers, having some good wine. And, of course, the listeners out there, when you pick up the noise in the background, I've listened to the show quite a bit. They all actually doing a good job on the show. I'll give you a compliment on the air.
Well, thank you.
I've been listening to you sometimes when I've got the opportunity. But you pick up the noise in the background when you're driving, and why you're doing it is because you're hearing all the noise down at the bar downstairs. We're up on the second floor overlooking the bar, so it's kind of a fun setting. So, Dale, you got a couple very important young ladies on the guest list tonight, and I'm going to shut up and let you talk about something relevant and important.
Well, normally we talk about what the legislature did today, but the legislature did doodly squat today because the legislature is not in session. The legislature hasn't been in session since last Friday. They went on break last Thursday. They are off until tomorrow morning when they will be back in town. In the morning, committee hearings will resume and floor sessions will resume in the afternoon, and everyone in North Dakota can resume worrying about their life, liberty, and property. All right. So, anyway, we have with us Maggie Anderson, the Director of the Department of Human Services, and Deb McDermott, the Chief Budget Officer of the department. And we want to speak about Medicaid expansion. But first, Ms. Anderson, could you just describe for us, what does the Department of Human Services do?
Sure. The Department of Human Services administers various programs and provides funding for those programs, as well as provides direct services for programs for vulnerable people in North Dakota. And so if you look at our budget in terms of the dollars that go out the door, it helps to show what our department does. And 63 cents of every dollar that goes out the door goes to what we call medical assistance grants. So those are our traditional Medicaid services, our Children's Health Insurance Program, services for the developmentally disabled, nursing homes, and our home and community-based services. And then about 10 cents of every dollar goes to the services that we provide directly through the Human Service Centers, through the State Hospital and the Developmental Center. And then 20 cents of every dollar would be what we refer to as direct client services. So those are the TANF program, the Temporary Assistance for Needy Families program, our Supplemental Nutrition Assistance program, our Heating Assistance and Child Care Assistance programs, and then 7 cents of each dollar is for the administration of those programs within the department. So our focus is to provide services and administer programs that help improve the lives of people.
Can you tell me how, that you mentioned 7 cents out of every dollar goes to administration. How does that stack up to other state agencies? I guess other human services agencies in other states. Do you know?
I do not know that number.
Okay. Do you think that that's a good ratio?
We do. We think it's a very good ratio. It's remained pretty consistent in that range for many years. And so even as our costs go up, whether those be inflationary costs or legislative increases for salaries, we've remained in that 6 to 7 cent range.
And medical assistance grants, can you talk a bit more about what those are?
Sure. It's basically everything that's funded with Medicaid dollars or state-funded home and community-based services dollars. So within the Medicaid program, that's dollars out the door to hospitals, to pharmacies, dentists, chiropractors, nursing homes, providers who serve the developmentally disabled, as well as what we call our home and community-based services. So those are people living in the community who are enrolled to maybe take care of an elderly or disabled neighbor or somebody across town. So it's that whole scope. And then I should include our children's health insurance program is also included in that.
And speaking of Medicaid directly, who gets Medicaid now? Who qualifies for Medicaid benefits?
The traditional program is generally pregnant women, children, caretakers or of those dependent children, and the elderly and disabled population. And
can you tell me what sort of benefits are available for someone in the Medicaid program?
The Medicaid program in North Dakota is a fairly comprehensive benefit package. We cover all of the mandatory services. Those are required by the federal government, and those are your services like physician services, inpatient and outpatient hospital services. And then in addition to that, North Dakota covers many of the optional services. And interestingly enough, pharmacy benefits is an optional service. Most of your therapies are optional services, as are dental and a variety of other targeted case management and a variety of settings that we provide services in. So we have a fairly comprehensive package of services.
Of Medicaid, how much does the state government pay the state taxpayer in North Dakota, and how much does the federal government pay?
The match rate is based on what's called a federal medical assistance percentage, and North Dakota's federal percentage has been declining over the last couple of years, and that's because it is determined on an average as compared to the rest of the country. And so as our economy has been strong and doing well, on average our per capita income has been doing better than in other areas. So our federal medical assistance percentage has been declining, and currently it's at 52.27%. So for every dollar that we spend, 52.27 cents comes from the federal government, and the remainder comes from the state. As of October of this year, so October 1 of 2013, our federal Medicaid percentage will be going to 50%, which is currently the lowest it can go under current law, and so that is the percentage that we will be at, we see, for the foreseeable future.
And how many other states are at 50%, do you know?
There are a number of them. I don't know if Deb knows.
There are 12 states.
Okay.
12
that are
states?
at 50%.
Anyone in our neighborhood?
No, most of them are, I believe, I don't have all that information right now, but I think some of them are out east, and I don't know of any of them right in this area.
Okay. And so, if I understand you correctly, Ms. Anderson, because North Dakota's economy is doing well, we're having to pay a greater share of cost of social service programs.
Of the Medicaid grant,
yes.
That's correct.
Okay. And as far as expansion of Medicaid coverage, as you know, the legislature, the House specifically, approved giving the department authority to pursue this. And can you tell me, what does expansion of Medicaid coverage mean?
The Medicaid expansion, as called for in the Affordable Care Act, would cover all individuals under the age of 65, including the childless adults, which is the group that historically has not been eligible for Medicaid unless they were disabled. And so that is really the large portion of the expansion, is to cover individuals who do not have dependent children and who are not otherwise disabled. But it would be covering all individuals under the age of 65 up to 138% of poverty.
How much is that in terms of one's income?
Well, for a household of one at 138% of poverty, it's a little over $15,000 a year, and for a household of two, it's about $21,000. And the reason why I use households of one and households of two for this, because typically in Medicaid we talk about households of 3 or 4, is because these are households that won't have dependent children in them, very likely, because otherwise they would have been eligible under the previous program guidelines.
So if you have a single person or a couple, married or unmarried, would they have to be married in order to qualify?
No, they would not.
Okay. So if you have a couple married or unmarried or a single person, they don't have kids, they would qualify if their income was at or below those guidelines
right.
you mentioned.
So about 15 for a household of one and about 21. And that really is the distinction with the expansion is historically childless adults who did not have a disability were not eligible for Medicaid regardless of their income.
Do we have any idea how many folks would qualify under those criteria?
Our estimates from the department, the estimates that we prepared through our research office, we're estimating around 20,500 people in North Dakota could be between 0 and the 138% of poverty. The Kaiser Foundation has completed similar estimates nationwide for each state, and their estimates are closer in the range of 32,000 individuals in North Dakota. So we have provided estimates to the legislature for that entire range. And in the end, it really will depend on what the take-up rate is, whether people are motivated because of the individual mandate, whether people learn more about coverage options because of the outreach that we expect to occur with the Affordable Care Act, whether the health insurance exchanges that we've all heard about will make it easier and simpler and more seamless for people to apply for coverage.
Okay. When you talk about the individual mandate, what does that mean?
Within the Affordable Care Act, there is an individual mandate that all individuals above 100% of poverty are mandated to have health insurance. And if they do not, there's a penalty assessed with that. My understanding of how that penalty works, because it's really outside of the Medicaid piece, is that it comes back through the tax returns as we file our individual tax returns.
Okay. And this expansion of Medicaid, do you know who's going to pay the cost of that? Is it going to be the state taxpayer or the federal taxpayer, or what happens?
The first 3 years, the way the law is written, the federal government would pay 100% of the shares. So starting in calendar year 2014, so calendar year 2014, 2015, and 2016, 100% of the share would be federal government. And then it tiers down until calendar year 2020, and at that point the state would be paying 90% share.
And do we have any idea how much that's going to be in terms of the total expense?
For the next biennium?
For the next 3 years, for example. Or the next biennium.
For the next biennium, we estimated, and this was based on covering the group in a plan that's similar to the Medicaid program today, and we had estimated anywhere between $101 and $157 million. And again, that's using that range of the department's estimated enrollment in the Kaiser. Now, with the amendments that the House added to House Bill 1362, which is the Medicaid expansion bill, we are preparing a new fiscal note because one of the amendments that they added was that this group would be covered with private insurance, either through a bidding process that the department would engage or through the health insurance exchange. And private insurance will be more expensive than the Medicaid coverage, and so we know that that number will go up.
So we're talking a minimum, if I understood you correctly, of $101 to $157 million over 2 years?
That is correct.
Okay. And that would be state expenditure, or that'd be covered by the federal government?
For the first biennium, it will be federal.
Okay. And how would it work if administered by insurance companies, private insurance companies?
If it's administered by a private insurance company outside of the exchange, we would see that as operating very similar to our children's health insurance program today. We have an RFP out for that, request for proposal, out for that right now, and we select a vendor, and it's a competitive process. So we would see it as working very similar to that. If we go down the avenue of allowing the people to go through the health insurance exchange and picking a private option that way, then we could be working with multiple private insurers. But in either of those situations, the way that in the end it would work is that the state, with the federal funding, on behalf of the individuals who were eligible, we would pay the premium, and then that private insurance company would process the claims. They would do all of the utilization review, all of the member management, all of those types of things that we do currently for our Medicaid population. As
far as a private insurer handling this, would it be just one, or would it be more than one?
It's possible that it could be more than one. In that really, the amendment was offered in the couple of days right prior to crossover. So as the bill goes to the Senate now and there's more discussion, we'll probably need to find out whether it is the intent of the legislature that we do a sole source contract if we were to put it out on a request for proposal, or whether they would like us to set a baseline in terms of a per member per month, and anyone who can meet that, we would award contracts for that. There's a lot of variables that come into play when Medicaid gets involved with offering private insurance, because we essentially have to run those as managed care contracts. And so our federal partners, which is the Centers for Medicare and Medicaid Services, have a lot of parameters as to how we have to operate within something like that.
This Medicaid expansion, what sort of benefits would have to be included in that?
At a minimum, the essential health benefits that are defined through the exchange would have to be offered. And then if we were to offer any additional benefits, we'd have to look at that. Traditionally, Medicaid programs offer what we call non-emergency medical transportation, and that's assistance with helping our individuals who don't have access to transportation get to their medical appointments. And so we have to look at those kinds of things as wrapping those around those essential health benefits.
I was just wondering, how would it differ from the benefits that people who are already on Medicaid have?
Well, if we would go with just the essential health benefits and no additional services, and the actual benefit package wasn't discussed a great deal on the House side during the debate of the bill in terms of in the committee. We provided some options as we did testimony on the bill. So that's probably another area where we need a little more clarification, because if we were just going to offer the minimum essential health benefits, it would be less of a package than what the current Medicaid population is receiving. And the Affordable Care Act actually indicates that that's okay. You know, that what was envisioned was an essential health benefit package for this group, or in what they're calling a benchmark package.
Can you tell us what is an essential health benefit? Can you give us some examples of what those are?
I can. They're defined in the Affordable Care Act, and they're things like hospitalization, physician services, habilitative services, rehabilitative services, dental and vision, and there are, I think, 11 or 14 of them, and I don't have them all memorized.
How would you describe it as an insurance plan? Is it a good insurance plan?
The essential health benefits?
I guess I'm talking about Medicaid coverage. I mean, if you're going to go out and buy Medicaid coverage, would you think of that as a pretty good benefit package?
Yes. The current North Dakota Medicaid benefit plan for the Medicaid enrollees is a very good comprehensive package. And
for how long has it been that way? I mean, there were some debates in the 90s, for example, about whether we should have optional services and what they should be, and whether we should pay for them. We meaning the taxpayers of North Dakota. Sure. Has the benefit mix changed that much in recent years?
No, it really has not. There were some changes in federal law in I think it was like around 2000, where it mandated the coverage of rural health clinics and federally qualified health centers. But that, again, isn't necessarily a different service. It's just a different delivery of a physician service. And sometimes, as in the department, we're asked to run analysis on, well, what would we save if we eliminated the optional benefits in Medicaid? But it's not a significant portion of our expenditures. And if you look at our $2.8 billion budget that Governor Dalrymple submitted as the executive budget request, about $1.8 billion of that is in Medicaid. And of that $1.8 billion, $1.1 billion is in long-term care and services for individuals with a developmental disability. So about $700,000 is in those traditional services, your hospital, your physician, your dental, your vision. And, a good chunk of that is in the hospital and physician services. So our optional services aren't a big portion of the Medicaid budget.
Can you tell us what some of the optional services are?
Sure. Optometric services is optional, dental services, physical therapy, speech therapy. We have some targeted case management, pharmacy services. So
these folks that are going to be eligible for Medicaid coverage, should we expand Medicaid, will they have to pay anything for the coverage?
They will not have to pay anything in terms of a premium or an upfront cost, but I would suspect that similar to our current program, we have cost sharing in terms of co-payments on services, where we have co-payments on physician services, dental services, inpatient hospital services, and so I would see us exploring similar options for this group. We would have to do that within this private coverage that is now part of House Bill 1362. We would have to specify what that cost sharing would be as we would move forward because that cost sharing influences the per member per month amount that we would pay.
As far as who handles the expanded Medicaid coverage, whether it's a private insurer or the Federal Health Exchange or the Department of Human Services, do you have any preference there?
Not necessarily a preference, but we certainly had thought within the department and within conversations with the governor's office and the Office of Management and Budget that a private option was a good way to look at least for the first few years, because we don't know how many people will come forward and sign up for this coverage. And so to build an infrastructure within the department in terms of staffing, to construct that new benefit plan, it made sense to look at that private option. And let's say that it is 32,000 people who come forward. Then we know then what we construct the system to look like. Also, we don't know what benefits they're going to use. So maybe this group will have high medical needs, maybe they'll have very low medical needs. It's unknown because they've never been covered through the public health system, through a Medicaid type program before. And so in these first 3 years, especially when the financing is 100% federal financing, to take that as an opportunity to look at how many people come forward, what their medical needs are, receive utilization reports from the private companies, and then the legislature does have a sunset clause on House Bill 1362 for August of 2017, and then be able to report to them how many people are using the program, what types of services they're using, and then they can make a decision about how they'd like to construct the program from that point forward.
We've been speaking to Maggie Anderson. She's the director of the North Dakota Department of Human Services, which is the largest agency in North Dakota state government. We also have with us Deb McDermott. She's the top financial person at the Department of Human Services. And we've been talking about the expansion of the Medicaid program, which the North Dakota legislature has been debating and will continue to do. The North Dakota House has already approved authorizing the Department of Human Services to expand the Medicaid program in accordance with federal regulations that will be coming down, and hopefully it will expand the number. This is Dale Wetzel. I'm the host of the Legislature Today radio program. We're in our second half hour. We're at the Peacock Alley American Bar and Grill in downtown Bismarck, and it's Teeny Tuesday, which means you can get 2 martinis for the price of 1, and it's a great time to be at the Peacock Alley. You can come down and enjoy a drink and a meal in a historically scintillating atmosphere, and it's a wonderful place. The servers are outstanding, and it's just a really good joint. And I'd be saying that even if we weren't broadcasting from here, because it really is. I came here and ate and drank here before we actually started broadcasting.
Well, we do have lunch here pretty much every Saturday after the Saturday show, and they do have a great Bloody Mary breakfast. Now, I noticed you just have a Diet Coke. So
I don't have the Bloody Mary, no.
I noticed you don't do the Bloody Mary, but it's free with the breakfast. I mean, so you take that $7 Bloody Mary. So of course I can't give away something.
I can't stand the celery and the meat stick, so I just kind of.
You can share those with me.
All right. We have with us the Attorney General of North Dakota, Mr. Wayne Stenjum, and we also have Charlene Schweitzer, who is a forensic scientist with the Bureau of Criminal Investigation, and we're going to be talking about guns and drugs and things that people complain about. And first of all, let's get to what people complain about. And I'm talking about National Consumer Protection Week. And Mr. Attorney General, what is it that people talk about during National Consumer Protection Week?
Well, we talk about all the problems that come up and how people can avoid becoming victims of the various scams that are so rampant around the country right now. Here in North Dakota last year, we opened 912 formal complaints at our Consumer Protection Division and closed 889 cases. And during the course of the year, we're able to recover on behalf of citizens of North Dakota just over $658,000. That's in addition to civil penalties that we sometimes assess against violators as well. Our number one complaint last year were do not call law violations. We have probably the best and most comprehensive do not call law in the country, and we get complaints when people violate them and violate that law. We like to hear from those folks, and we initiated over 24 formal investigations, filed lawsuits, collected $11,000 in penalties just last year. add that on to what we've done for penalties over the course of the last 10 years or so since we enacted our do not call law here in North Dakota, we have a total of about $450,000 in penalties against violators of the do not call law. That tells me it's working, and citizens do like our do not call law. They are very insistent that they put their telephones in at their homes for their convenience, not for the convenience of telemarketers. And there's been a dramatic drop in the number of unwanted telephone calls that people are getting. Now, we have problems that come up because individuals who are telemarketers are getting more and more sophisticated. It gets more and more difficult to track these violators down. They can buy a bucket of minutes from somebody that they lease from somebody else, and it's like peeling an onion trying to track through and find out who actually made those original phone calls. But when we find them, we find them heavily and require that in addition to the fine that they sign an assurance that if they do it again, they're going to pay anywhere from $500 to $1,000 per call. So we don't have many repeat violators once we find them, but finding them can be more difficult than it ever was before. Our number 2 complaint, identity theft. We had 100 complaints about people who have been victims of identity theft here in North Dakota. Those are difficult cases because it can take hundreds of hours for somebody to undo problems that arise once their identity has been stolen. Transient merchants is number 3 in North Dakota. If you don't have a fixed place of business to operate here in North Dakota, you're required to get from my office a transient merchant's license, and if they don't, we will find them. Typically, they are unlicensed. People are doing roofing or frequently driveway pavers who come in and say, I just finished a job and I happen to have some extra asphalt here, and I'll give you a heck of a deal on this asphalt if you'll let me get rid of the material that I have. And of course, it's always shoddy work when that happens. And we had 79 complaints of that alone here in North Dakota. Contractors and home improvement was number 4. Unlicensed contractors, poor workmanship, failure to do the work at all. You'll recall that I issued a cease and desist order against a company that was operating here in North Dakota. And also, we filed criminal complaints against those individuals. They'd taken thousands of dollars from individuals promising to construct buildings on farmsteads that they never got around to doing. And so I think those people might still be in jail. I'm not sure if they've made bail yet, but they're going to trial. And then the yellow page scams that are so common that businesses are complaining about, that they'll call up and say, we'll get you in the yellow page, and it's usually several $100s that they'll charge. There may or may not actually be any yellow pages, or they're billing people, just sending out a bill hoping a number will pay the bill, even though they never signed up for yellow pages. Mail order came in at number 6, failure to deliver what was ordered over the phone. Automobile repairs and services and used car sales came in at number 7. And then number 8 was services of one kind or another. Most typical is the home security system, and we have a lot of people who are in door to door now who are offering to sell home security systems, and some of those salesmen can be rather abrupt and insistent and hard to get rid of. So we've had a number of complaints about that. Number 9 is telephone, cellular phone service and other telephone services, cramming, slamming, those kinds of things. And then finally, the internet, and leading the internet problems were website business opportunities where people are contacting individuals and offering to over the internet and saying, we want you to become a part of a business opportunity, home shopper, those kinds of things.
I think that's the business Gary's in.
Is it, Gary? Well, we haven't had any complaints about you and your internet
I'm not.
website business yet, Gary. So
no, I'm not.
So that's
scared
fine.
me. I should be listening here.
The main theme this year is that because the internet has become so ubiquitous, it is very easy to fall victim to any of these scams over the internet. And we all get those emails saying that our bank account is about to be closed or locked, or you're not going to be able to get your ATM, or your credit card is no longer going to be useful. All you need to do is click this link and then give your account number, your password, your mother's maiden name, and all that information. And we constantly are reminding people, never give out information, never ever give out information to anyone who calls you on the telephone or who sends you an email. I have a strict rule around my house, and it served me very well. I don't do business over the phone. To anybody who calls me, I just tell them my immutable uncompromising position is I don't donate money. I never enter into a contract over the phone. Send me something in the mail. And then I'll look at it at my own leisure, and I'll make my own decision what I want to buy or what charity I might want to give to.
Wayne, got a quick question. When you do a do not call, can you register your cell phone? Because like in our case, we don't have a landline anymore, so I just go online. So listeners out there, you can register your cell phone as a do not call. Because I'm starting to get more solicitors.
We were the first in the nation to authorize listing of a cell phone on the do not call list. You can do that, and we're also attempting to do something now this session to get at the same problem that comes up with text messages, unsolicited text messages that come, and those are particularly obnoxious because unless you have an unlimited texting option with your phone, you can find you're paying to have somebody send a message to you.
That's right.
What's covered by do not call? I mean, who are the people who can't call?
Nobody can call if you're on the do not call list, except for political parties can call, and charities can call if they're calling with their own employees and not employing a telemarketing company who collects a percentage. So a charity can call if it's their own employees or people that they are paying or volunteers calling for the charity. Mm-hmm. And so there are not many exceptions in North Dakota. We tried to look at what other states had done, problems that they had seen, and avoid them by being as restrictive as we could.
One of the other subjects we wanted to talk about was synthetic drugs, which is an increasing problem in North Dakota. And we have the Attorney General, Wayne Stengen, with us, and we also have Charlene Schweitzer, who is a forensic scientist, and one of her jobs is to track down what exactly these synthetic drugs are made of. And I understand that it's quite a fascinating job, Ms. Schweitzer. Can you tell us a little bit about how it's done?
Yeah, well, there's just so many different types of synthetic drugs out there. We have these synthetic cannabinoids, which mimic marijuana. They act on the brain similar to marijuana would. And lots of those are sold in various packaging and such. And there are over hundreds of compounds that can be seen in these products. And then we also have products called bath salts. They're marketed as bath salts. And those are stimulants. They mimic methamphetamine or cocaine. And then more recently, we've had a surge in the synthetic hallucinogens, which mimic LSD. And so there's just various different types of drugs, and we see it all here in North Dakota.
Why is it that people feel the need to synthesize these substances? I mean, why don't they just sell the real thing?
It seems to be a huge moneymaker, and they're just trying to get around the legality of the law. It seems like, they just mimic something that is controlled, but yet it's technically just a little bit chemically different, so then they can get around the law. It's technically not controlled at that point.
How easy is it to make these synthetic drugs?
It's not very easy. This is not something like methamphetamine where people can get their household chemicals and mix together. This takes some very, good chemistry, a good chemist to make these. A lot of these are not thought to be synthesized in the United States. A lot of these are thought to be synthesized around the world, in China, in India, places like that, and then they are distributed throughout the world. And then people create their own products and sell those products as such.
When something comes in and you have to look at it, can you tell us how you figure out what it is?
Yeah, we depending on what we're dealing with, we'll just start with a random white powder. There's various chemical tests that we'll do, and then we do different extractions to isolate that compound, and then we'll basically use an instrument called the GCMS, gas chromatograph mass spectrometer, which separates the compounds, and then it will hit each compound with a beam of electrons and fragment that compound so that it basically produces a fragmentation pattern for each compound. So that's where we're able to identify that compound and say it is cocaine or it is methamphetamine, and each compound has its own individual fragmentation pattern.
What kind of equipment do you need to do this, and how expensive is it?
The gas chromatograph mass spectrometer is hundreds of thousands, probably $100,000 just for one.
How many do you have?
We have 5 of them at the lab, and they are always being busy. We're always waiting in line to run more samples.
Literally waiting in line? I've got this.
We have 5 other chemists at the crime lab, and we basically each have our own, but we're adding samples, nonstop.
I brought Dale a chart here of the workload that they've got at the crime lab, starting in 2008, where they had no samples of synthetics that came in. In 2009, there were 10. By the next year, 2010, there were 311 samples that came in. The next year, 2011, 906, and in 2012, we had 1,470 samples that were coming in to the crime lab to be tested. And Char will tell you that this is much more difficult to analyze than marijuana or cocaine, some of those that are really fairly simple and you just have to check for one thing. Why don't you talk about
I was going to ask you, how long does it take you to figure out what a particular substance is?
Yeah, the problem with these is, like for marijuana, you can morphologically identify these things. But with these, they're constantly changing.
I'm sorry, you just use morphologically. What does that mean?
Basically, marijuana, we macroscopically, we look at it macroscopically and microscopically, and then we'll all do some chemical tests on it. Where these, we have to extract them and run them on our instrument to confirm what they are. But the problem is these compounds keep changing, and we keep having new compounds come out where we're constantly trying to figure out new unknowns, constantly talking to other labs throughout the United States, throughout the world to determine these new unknowns, because these products keep continuously changing. There was a time last summer where we were identifying a new compound practically every week. So it's just, and it then also, in order for us to make a identification, we have to have a valid standard available, purchased by a representative chemical company. And a lot of these are so new that there's not even standards out there for us to make a true identification.
And Mr. Stenjum, how difficult is it, given the sophistication here of these chemicals, how difficult is it to prosecute people for using them illegally?
That can be a very difficult situation. We started in 2011 with the legislature coming in, and we had a statute that prohibited these synthetics. And, of course, in order to prosecute somebody, you have to specifically delineate in the statute what it is that is illegal. Otherwise, you can't do a prosecution. So we listed all of those that we could think of in 2011 and thought that we had solved the problem of actually determining what was illegal. And by the time the law took effect in August, that next week, I think the folks at the crime lab were already seeing new formulations that came along. So now we've introduced in the legislature a bill that we'll talk about that I think will really cover everything, because the statute provides that the core chemical will be illegal, plus any variation that might later be developed by scientists around the world will likewise be illegal, and I think that is something that will take care of the problem.
And how many variations are we talking about here? Hundreds, thousands?
Hundreds, thousands,
okay.
Yes.
And these were, as Shar was mentioning, were initially sold as on the package or on the advertising, legal alternatives to illegal drugs. And in many instances, they were actually legal. The problem with them is that what we started to hear is that emergency rooms were becoming overwhelmed with individuals coming in who were on these substances. And of course, because they do not have a long history, we don't have any lengthy medical studies about what the effect of these drugs are on individuals. And we were finding out in the emergency room that the consequences indeed were extremely dangerous. And in eastern North Dakota, as is well known now, we had 2 people died who had consumed these kinds of substances. But every emergency room doctor in North Dakota will tell you that they were seeing people coming in to the emergency rooms with incredible medical complications, racing hearts. One individual, or several individuals, described it as a feeling that their heart was actually going to pound right out of their chest. They become disoriented. They can become extremely combative, and they're very difficult to deal with in the emergency room. Law enforcement are seeing these folks out on the road. They can become almost superhuman strength, and as I mentioned, extremely combative, very violent, and difficult to deal with. That's as that went along, that's when we realized we had to figure out a way. I think it's well known by now that they issued a cease and desist order against 3 of the head shops that were well known for selling these synthetic drugs around the state of North Dakota. And we're prosecuting those individuals as well, and we'll continue to do so.
Ms. Schweitzer, what's fun about your job? What's challenging about it?
Every day is different. Each piece of evidence is different. Each case is different. And just in the last 4 years, all of these new synthetic drugs, has made each day different. We're constantly learning new techniques, constantly finding out new drugs, and so it doesn't get routine at all.
One of the other things I wanted to speak about this evening is there are some laws that the legislature is debating that deal with concealed carry permits and also where you can carry a gun. One of them says essentially you can carry a gun in a school if you have the school board's permission and if you have certain training, that you have this type of permit that requires certain firearms training. Another one says you can carry a gun in a church if you have that same type of permit and you have the permission of the church leadership. And then there's another that's more, I guess I'd say it's more broad. It says you can carry a gun in public gathering places if you have a concealed weapons permit, and this would include, I think, public buildings, music concerts, sports events, those types of things. Do you have any particular opinion, Mr. Stenjum, on any of these as to whether it should be easier to carry a gun concealed in public?
Well, I do. There's, by my count, I think about a dozen different bills that deal with concealed weapons and with dangerous firearms and weapons in North Dakota. I don't have a problem with any of them. Some of them are rather really not that consequential. A couple of years ago, for example, we authorized municipal judges to carry concealed in their offices, and forgot at the time that not all municipal judges are law trained. The law required that, so the bill came in to say that the municipal judges who are not lawyers are covered by that statute. So a lot of them are not that consequential, such as that one. The ones that probably the most controversial is the one having to do with the carrying in the church or in the school. I don't have a problem if churches want to allow people, and they make a decision that they should allow concealed carry in their church or even in the school, except that I would caution that any school that is going to authorize this perhaps should consider doing something more than simply saying you have to have a Class 1 concealed weapons permit. That requires, of course, additional testing, and unlike the Class 2 license, you have to actually show that you are capable, and you have to do an actual test where you actually shoot the weapon. But there's a little bit more to training for shooting weapons than just knowing how to do it and what the law is. Every law enforcement officer is required to undergo regular, rigorous weapons training, and I think that a school who is considering doing this needs to make sure that there's regular, ongoing kinds of training to make sure that the people who may be carrying are fully trained, carefully capable of knowing exactly what to do. I've talked to many law enforcement officers who have had the difficult decision where they had to actually shoot at somebody, and it is not an easy thing to do, and it is not something that you do without a lot of fear and apprehension. And so I think that a requirement for rigorous training is something that a school ought to fully consider if they're going to implement this statute if it passes through the Senate.
And when we talk about rigorous training, we're talking about something more than what you need for a Class 1 concealed carry permit.
And that's something that the school board would have the authority to require, that there be ongoing training, just like a law enforcement officer has to get regular training and recertification on shooting a firearm, and I think that would be something that would be quite wise for a school board to consider requiring.
Have you had an increase in the number of folks asking for concealed carry permits?
The number of applications for concealed weapons permit in North Dakota has absolutely skyrocketed. We had 4,000 of those that were issued just 10 years ago. In 2009 through 2011, 8,500. And in the 2011-13 biennium, that number almost tripled to 22,345. So from 8,500 to 22,000 in just a one-year period.
And what do you attribute that to?
There's a number of reasons for it. Frankly, whenever there is talk on the federal level of additional restrictions on weapons under the Second Amendment, that always spurs a number of applications that come in. In addition to that, I think public safety is a consideration. We see that because a lot of the increase in the concealed weapons permits we're seeing in North Dakota are coming out of western North Dakota. And then in addition to that, there's a number of people who are offering classes on obtaining the Class 1 license, and they promote it. They're out advertising and encouraging people for good reason to consider getting a concealed weapons permit. All of those things together, I think, have resulted in the dramatic increase. And I will tell you, we issue these concealed weapons permits, of course, through my office, and the amount of work that we're seeing, the workload has skyrocketed, and they're bulging at the seams in the number of requests for concealed weapons permits we're seeing in North Dakota. We've now come to the point where we are asking senior citizen volunteers to come in to help process them, because we don't have the staff in my office to actually accomplish getting those licenses out. We have 45 days to get them out, and so we're trying to do that. We're also looking at changing the statute this year because to speed up the process a little bit. Right now, if you apply for a concealed weapons permit, you initially make that application to the local police and the sheriffs, and then they have to do the background check that's conducted through my office. They conclude that. They send it up to BCI. They do their additional work. And, of course, the local law enforcement are becoming overwhelmed, especially in western North Dakota with everything going on in the oil patch. They asked us to come up with some way to kind of streamline that, and it seemed to me the wise way to do it is tell people, why do you have to go to the police department or the sheriffs for them to get in touch with my office to do the criminal background check? Why not just send them all to my office, and then we'll complete that, do all the work that needs to be done, and then issue the license to those who are entitled.
We've been speaking to Attorney General Wayne Stangham. He's the gentleman whose voice you've been hearing for the last few minutes, talking about concealed weapons carry permits, and there's been a huge increase in the number of permits that his office has issued. We've also been speaking to Charlene Schweitzer. She's a forensic scientist at the State Crime Laboratory, and she's been really busy these days analyzing synthetic drugs. And we really appreciate your coming in this evening, and thank you very much, and hope we'll have you back again sometime to talk about this again.
Thank you.
Yes, thank you very much, Dale.